and welcome to the podcast series sponsored by Aster Hospitals. I'm your host, Pallavi. In this episode, we are talking about spine health. We often use these phrases, right? That he is the backbone of the team. She is the backbone of our family. Backbone means strength and support. The real one inside the body is much more important. It's because of the spine we are able to sit, bend, get up, dance, and it's truly a marvel. To tell us more about spine and how to take care, we speak to Dr. Yadhu K Lokanath, consultant neurosurgery and spine surgeon at Aster RV Hospital, Bengaluru. Hello, doctor. Welcome. Doctor, we often call spine as a scientific masterpiece, and it's one of the brilliant designs of the human body. Why is it so?
The human spine is a nature's marvelous creation. If you think about the human backbone, the spine, what we call it is, it's a scaffold and switchboard of the human body.
Okay.
Because it not only helps us to walk, we run, we dance, we can do a bungee jumping. It's truly where the form meets the function. Strong, yet flexible, stable, yet mobile. It's an elegant one structure where there's a harmony between physics and biology.
Wow, that's a very nice way of putting it across, doctor. October is observed as Spine Awareness Month. Why do you think there is a need to create awareness about spine health?
Yeah, so globally, October is regarding as Spine Awareness Month. It's just to remind us that we cannot literally live without spine or the human backbone.
Okay.
So it's your spine, it's our health. Okay, and there's a rising prevalence of spine degenerative disorders, that is the aging spine, leading to disability issues, long-term health complication. To raise awareness, the World Spine Day celebrated on October 16th globally, with this year's theme being Invest in Spine Health.
Okay.
So make your spine health a priority. Invest early for a better future.
I will definitely get to the degenerative part of the spine, doctor. But before that, we also understand there is something called as cushioning and discs. Could you please explain this in simple terms for us?
So, the human spine, as I told you, is a marvelous structure. The key to everything is it makes us do everything from the time we stand to feel the sense of touch. Roughly, to decode the human spine, it is a framework. The cervical, what is called the neck, where it has 7 vertebrae supporting the head torso. The S know what you are doing. The nodding and shaking is done by that. The mid back, the way you walk, supporting your chest, heart and lung is done by the dorsal spine. Lumbar spine, bearing the body's most of the weight, helps us in bending, standing, everything. Bottommost we have the sacrum and the coccyx. The coccyx being the tiniest part of the human bone, though it's regarded as vestigial, but any small trauma can lead to a agonizing pain.
Okay.
These cushions, I call it as, these are the unsung heroes. They're sandwiched between the two vertebrae. They are the spinal cushions, the shock absorbs, which help in moving, assisting the vertebral movement between two intervertebral bodies. This is made up of two things. The inner one is an annulus, which is soft jelly-like material, which is very soft but yet courageous to take over movements. And the outer thing is an annulus, which protects the inner nucleus pulposus. The other things are muscles, the ligaments. The muscles are the bodyguards, the ligaments are the cables and the springs, and the spinal cord, which is a super highway of network. The spinal nerve, motor component is there, which helps us to communicate from the brain to the muscle. The sensory nerve, touch, getting back is all done by. So it's a complex network. In simpler terms, I put it forward to you.
What are some early warning signs that people must watch out for?
We humans are emotions. We carry a lot of emotions.
Correct.
And we cry, whether it's a joy, sorrow.
True.
But spine doesn't cry. It whispers. Don't ignore those whispering episodes.
Okay.
So I'm coming to the bullseye, the warning signs. I think you're asking about the warning.
Yes.
So let's discuss the warning signs. Any recurrent, persistent back pain, neck pain with fever, or back pain, neck pain following a trauma. Numbness, tingling, pins and needle sensations in the arms and the hands. Weakness in the hands. Some patients do come to me. I'm not able to grip my pen. I'm not able to button my shirt. I have a change in handwriting. I have a difficulty in balancing, initiating a stance or initiating a walk. Some patients do come with I'm unable to control my urine. Urine has passed without knowing my knowledge. And of course some anesthesia or sudden anesthesia in the groin areas. At last, the rest pain even while sitting. So these are some warning signs, or to put it in a a broader term, it is red flag. So these signs should not be ignored. Any of these signs should alert you, and you should visit your spine surgeon.
How does our daily posture or watching mobile or working on laptops, how does these affect our spinal health?
So poor posture leads to mala in spine. Like poor posture, sitting for longer hours can alter the normal curvature of the spine. The spine is normally shaped in the form in S shaped. So this leads to altering the spinal curvature. This creates muscle imbalance, increased stiffness, reduced flexibility, and overstretched spine, leading to back pain and disability, which can lead to difficulty in walking, difficulty in sitting, doing any daily activities. To answer your second question, I would put it like this: cell phones, the silent killer of your spine. Any movement which causes your head to tilt forward causes excess stress on your neck muscles, and every inch bending forwards can cause more strain, more stress, leading to chronic fatigue syndrome. It not only hurts the neck, it goes back, so your main core muscles get switched off.
Okay.
So the tip here is you can use phones, proper posture, earpods or hands free, and take frequent breaks.
And with respect to sitting, doctor, how do we balance that?
So design your desktop. Have your screens at the
Up to
level
the
of your eyes. Use a good shoulder support, good lumbar support. Don't dangle your legs down. Yeah, these are few things. So ergonomics is entirely a different topic altogether. So having a good proper back support, taking frequent breaks, not more than 20 minutes at one go, take frequent walks, do some silent stretches, do breathing exercise. These are the way to go.
Okay. How does aging affect spine health, doctor?
All of us have to accept the aging process.
Correct.
Aging is inevitable.
Absolutely.
Wrinkles can come in, hairs can go grey. But if you understand what happens to the process of aging, we can get aged smarter but not weaker.
Okay.
Okay. So what happens to spine is, as we age, the bone get weakens. Something called as osteoporosis sets in, where there's an imbalance between the calcium formation and how does it get excreted. The spinal cushions, what we call as shock absorbs, become brittle. They get dehydrated. The cushiony effect is gone, losing their function. The facet joints lose their function. The muscles become floppy, sunken, and worn out. On a whole, we cannot prevent the aging process at all, but we can deaccelerate the process of what we call as spine degeneration by following healthy tips, keeping us active, doing simple exercises. Yeah, but not just walking. You need to have for example, swimming is the best exercise, and we have certain exercises for the neck. We call isometric exercises, back like core strengthening exercises. Basically, you should form a proper regime protocol, then get into it. Then spine is in your health, your spine, a happy spine.
Doctor, many people think that resting is the only solution for back pain. Is it really true, or should we be physically active?
The answer is straight no. It's a common misbelief. Acute back pain, yeah, there is a role of rest for brief periods, like bursts of. But on a chronic thing, the more you rest, the healing process is hastened, the recovery is slower. What happens is a 1 week or 1 day of bed rest can lead to 1% loss of muscle strength. At the end of 2 to 3 weeks, you have lost your 20 to 30%. So the trick here is balance.
Okay.
Take rest when you need in short periods and be active, because your spine is made to move, not to sit at one place.
What are the most common lifestyle mistakes that are affecting spinal health, and how do we correct?
The first important thing is posture. Slouching. Watch your posture at work. Whether you're working 9 to 5, whether you're working midnight. Next important thing is be active. Don't be a couch potato. So I mean to tell is, don't lean or don't have a sedentary lifestyle.
Okay.
Third most important thing is be active. Don't be a weekend warrior.
Okay.
Avoid junk foods, because junk foods lead to obesity. Obesity, to accommodate your belly, the spine has to take a separate curvature, so entire muscle balance changes.
Okay.
Next important thing is smoking. So what happens in smoking is the end plates, what we call as vertebral end plates, the oxygen requirement and the nutrition which is required, the nicotine in the smoke reduces it. So that alters and accelerates degeneration. So avoid smoking. Keep yourself hydrated. Next two important things, especially keeping the young girls in picture, avoid heels and worn-out shoes because they change the entire biomechanics of the spine. And wearing clutches, vanity bags, you look gorgeous, but you're hurting your spine. The compensatory spinal mechanism comes into picture, and there is an imbalance between one shoulder, other shoulder, leading to pain.
How can we strengthen our spinal health? Maybe could be lifestyle changes or diet. Is there anything like that, doctor?
So again, I'd go back to my last question: avoid junk foods. Eat foods which are rich in vitamin C, calcium, green leaf vegetables. Have a good sunlight exposure. There's nothing like magic foods and all. A good healthy diet which has green leaf vegetables, some amount of vitamin C, D, everything. So you should have a wholesome meal.
October is observed as Spinal Health Awareness Month. Before we wrap up, doctor, what are the 3 golden rules that you would like to share for a very good and a healthy spine?
Have a spine protection plan.
Okay.
We buy new cars, we buy new cell phones, we buy everything whatever we want. At the end, we ask for a protection plan. But why don't we have a protection plan for ourselves? It's not single exercise or single meal. It's a combination of simple, daily, small, mindful habits which takes us to prevent a lifetime of pain. 3 important goals: move, align, fuel, and relax. Be active, exercise regularly, sit, stand, walk with a good posture. At the end, relax, refuel, eat well, sleep smart, stay hydrated.
Doctor, thank you so much for sharing a lot of information. You did share a lot of insights. Thank you so much.
So before we conclude, your spine is your health. Invest early for a better tomorrow.